Any new mother, me included, will tell you there's nothing more terrifying than the prospect of your baby contracting an infectious disease before they're immunised. Whooping cough is one of the scariest. In the last 4 years, 8 babies under 4 months old have died after contracting it. In 2008, after a whooping cough epidemic, free vaccination schemes were introduced. But Victoria has now moved to scrap its scheme, and other states are considering following suit. It's prompted one mother who lost her baby to whooping cough to take up a campaign. Lisa Whitehead reports.
These parents are getting ready to take their new baby girl home from hospital.
It's just a bit of a scratching on the outside.
Before they leave, this new mum is getting a free whooping cough vaccination, increasing her immunity to a highly infectious disease that kills 1 in 200 newborns who catch it.
Tragically, when we look at babies, where did they get that infection? In many cases, it's actually from those significant adults, either mum or dad, in the household.
Babies don't get their first vaccination against pertussis or whooping cough until they're 6 weeks old, and they're not fully immunised until they reach 4 months.
It's those first initial 4 months a baby's completely unprotected. So if people around them can be protected, then they've got a fighting chance.
It's been thought vaccinating adults in close contact with newborns offers babies a chain of protection. It's called cocooning.
By immunising their parents, that's, the biggest single potential source, but clearly there are lots of other sources, and that cocoon could have holes in it.
After 2008, when a whooping cough epidemic swept across the country, most states introduced schemes offering free vaccinations to new parents, caregivers and in some instances even grandparents.
How many adults overall have had whooping cough boosters? Probably about 10%. Amongst the particular target group, which is parents of young babies, I suspect that percentage has gone up quite a bit, since the various states have been funding programs. We don't have hard data about that, but my guesstimate would be that, maybe it's 40 or 50%.
But now, as infection rates have started to come down in most states, government programs providing the free vaccines have been shut down or are under threat. Victoria will scrap its scheme at the end of June. The New South Wales and Queensland programs are also only funded until then and are currently under review. Western Australia has just announced an extension, but only until the end of the year. The Australian Medical Association says it's concerned by the moves.
When it looks like we might be getting on top of this epidemic, we're taking one of the planks away which may actually continue that fall of the disease.
Tony McCaffrey lives near Byron Bay in northern New South Wales, in a region that has one of the lowest immunisation rates in the country. She lost her daughter Dana to whooping cough in 2009. She was just 32 days old.
I went to a doctor 4 times over 3 days until she was tested. The doctor said, no, it's just a cold, she's not hospital material. 5 days later, my baby is dead.
Since the tragedy, the McCaffrey family has fought hard to raise awareness through public health campaigns. Tony McCaffrey says their message will be undermined if the schemes are scrapped.
It leaves parents utterly confused, and at the end of the day, it leaves tiny babies vulnerable.
I had to stop once on the way down and get her out and take her back.
These parents all watched helplessly as their babies fought for their lives after being infected with whooping cough. Diane Cherry's daughter, Tori Rose, was the face of the Victorian Health Department's campaign to encourage adults to get vaccinated.
I was quite disgusted that I didn't even receive an email to let me know that it was going to be scrapped.
Today, an open letter signed by these mothers, Tony McCaffrey and 50 other parents, was sent to all health ministers, pleading with them to think again.
We're saying, please hold back on your decision to withdraw the program until you have a better solution. but don't just do nothing.
The Victorian Government's decision to scrap the free vaccination scheme is in response to a ruling by the Commonwealth's Pharmaceutical Benefits Advisory Committee, or PBAC. It rejected an application to place the drug on the National Immunisation Register, saying there was insufficient evidence evaluating the cocooning strategy, and so its clinical effectiveness was uncertain.
There's now been 2 detailed decisions by the Pharmaceutical Benefits Advisory Committee, as I say, an independent national body that's looked at these matters and actually concluded that the evidence isn't there to support a population-based approach.
And that's the nub of the problem. Professor Peter McIntyre is the head of the National Centre for Immunisation Research and Surveillance. He supports cocooning, and his centre is in the thick of a study assessing its impact.
We don't have concrete data to prove it's this much of a percentage protection, it's that much. We know that it should work, but we don't have hard data to prove it.
The upshot of PBAC's decision is the vaccination program doesn't qualify for federal government funding, and the states will have to keep paying. In Victoria, that's a cost of $3 million a year.
This has nothing to do with money. This is about evidence presented to the government.
PBAC also ruled the free vaccine program was unlikely to be cost effective. Since 2008, 8 babies under 4 months have died of whooping cough, not enough deaths to meet its criteria.
What they're saying is that the cost of free boosters for adults is too expensive. So they've put a value on babies' lives like Dana, and they've said it's not worth saving them. And it's a pretty hard thing to accept.
Alternatives to cocooning, including trials vaccinating babies directly 2 days after birth, are being investigated, but it's still early days.
We would say let's run the trials, let's have a look at a better opportunity or maybe a more cost-effective way of going about it, but please consider maintaining the funding until we get that data.
My fear is that in a few years' time I'm going to see another mother like myself on television, and it's a pretty horrid price to pay.
Lisa Whitehead reporting.